So we're looking at the appendicular skeleton. And when we began last week looking at the axial skeleton, we sort of make this distinction that functionally, the axial skeleton is really important in protection, right? Structure, support, protection, like the skull, the vertebral column, etc. Um, the appendicular skeleton is more suited for functional mobility, flexibility, just movement, right? So we want to think about the girdles. The girdles are the structures that anchor the appendicular skeleton to the axial skeleton. So we have a shoulder or pectoral girdle, and then we have a hip or pelvic girdle. So we want to look at the limb skeleton itself, but also that girdle and those major bones being the hip bones and shoulder bones. So let's begin there by speaking about the clavicle. So the clavicle keeps the upper limb movable. Again, appendicular skeletal is all about movement and mobility. So it allows our limb to be able to move really far away from our body while still keeping it structurally anchored, right to the thoracic wall. And then if we look at the clavicle specifically, it's the first part of that girdle. It's got a sternal end towards the sternum. Remember, the sternum is a part of the axial skeleton. We will talk about that in week 3, so next week, as a part of the rest of the axial skeleton. So the sternal end articulates with the sternum. The acromial end articulates with the scapula, the acromion of the scapula. Okay. It does have other bumps and landmarks, and it does have a convex edge and more of a concave edge as it curves from the medial end to the lateral end. It articulates at the acromion, so this is the acromion of the scapula, to form this shoulder girdle, right? Together, both of these bones forms the pectoral girdle. If you look more closely at the scapula, this is more of an anterior view of the scapula. We can see the acromion, right? The coracoid process, sort of like a beak-like process anteriorly. This is an important attachment for some of the muscles that we'll talk about in week 4, such as the coracobrachialis. We want to think about the superior border being the upper edge, the top edge. Here we're going to find muscles, arteries, veins. The subscapular fossa being all of this space anterior to the scapula. So this is the space that sits between the chest wall posteriorly, so the back of the ribs really, and the scapula itself. So this surface comes right up against the body wall. Okay, this is called the subscapular fossa. We also have the medial border, and the medial border is going to be towards the other scapula. So both medial borders of the scapula come together, especially in actions like retraction of the scapula, right? Where you bring the shoulder blades back. Then we have the inferior angle, sort of a pointed projection inferiorly, and then the lateral border being towards the axillary fold. So this is coming out towards the lateral body wall. And finally, the glenoid cavity being the ball or the ball and socket joint that forms the shoulder joint. So the shoulder is an example of a ball and socket joint. The ball comes from the humerus, the head of the humerus. The socket comes from the glenoid cavity, which is a part of the scapula. So this again allows all of the sort of rotatory movement that we see with the humerus that gives the entire limb a lot of its mobility. Let's look at a dorsal or posterior view. So looking at the scapula from a posterior angle. Some of the landmarks we can see here, again, coracoid process. Although it is more anterior, we can still appreciate it, as well as the acromion, right? The acromion, and the word acromion literally means the highest point. Okay, it's Latin for highest point. So it is the highest or topmost point of the scapula itself. Once again, we've got the glenoid cavity at the lateral edge, got the lateral border, the medial border, the superior border, and then the inferior angle. And then on the posterior surface of the scapula, we actually have two other fossae or two other spaces, the supraspinous fossa, which is above the spine of the scapula. So the spine of the scapula is continuous to become the acromion, And it really kind of separates the top third of the bone from the bottom two-thirds of the bone. So this runs across, giving us these two divisions, the top space being the supraspinous fossa and the lower space being the infraspinous fossa. Now, it's really important to think about these three spaces, the supraspinous, infraspinous, and then if we go back to the anterior view, the subscapular fossa. So these three fossae are going to be the location of muscles. We'll talk about the subscapular muscle in the subscapular fossa, the supraspinous muscle in the supraspinous fossa, and the infraspinous muscle in the infraspinous fossa. So connecting it with the muscles that will be found in these spaces can really help you remember the three of them. Let's look at a lateral view of the scapula. So we can see similar landmarks, more of that glenoid cavity, which again, ball and socket joint formed here, a little bit of the coracoid process and the acromion projecting superiorly. Let's look at the bones of the limbs itself. So looking more towards the actual upper limb skeleton. This is going to consist of the arm, the forearm, and the hand. So these are basically the three divisions of the limb. Arm being from shoulder to elbow, consisting of the humerus and its muscles. Forearm being from the elbow to the wrist, similar, the forearm bones being the radius and the ulna. And then the hand having a lot of smaller bones, carpal bones, metacarpal bones, and phalanges articulated together at several different joints. All right, so those are the divisions of the arm itself. And I do want to point out the word brachii. We'll talk about the word brachii, which means arm. So the brachial artery, the biceps brachii, the brachialis muscle, all of those will be pertaining to this part of the limb. And then we'll talk about antebrachial, which means forearm. And those will be structures pertaining to the forearm. Now, looking at the humerus more closely, its proximal end, we're going to find the head of the humerus, again, that ball or the ball and socket joint. And then we're going to find two necks. Okay, so there are two different descriptions of the neck. The anatomical neck, which was sort of devised by anatomists, they decided the neck would be the region just proximal to the head. So based on an anatomist perspective, that is where the neck is, right? Right, sort of distal to the head, the widest part of the bone. Surgically, or from the standpoint of a clinician or a physician, the neck is usually the weakest part, right? Functionally, the neck is the weakest or most vulnerable part. And so the surgical neck is going to be the more narrow, again, weaker part of the bone. So there's two different necks because, anatomists and surgeons couldn't get on the same page. So both of them kept their descriptions of what they termed to be the neck of the bone. Let's look at some of the other landmarks. So we have two tuberosities, and tuberosities are really just large, roughened projections, also important for the attachment of muscles. We'll talk about some of the rotator cuff muscles that attach here. So the greater tuberosity being the larger bump found more laterally on the head of the humerus, and then the lesser tuberosity being more anterior and medial, being the smaller projection on the humerus. So we will speak about the attachments to these two projections. And then in between these two tuberosities, we have the intertubercular groove. All right. And that is going to be where we find the tendon of the biceps traveling through. So that is another important landmark that we'll talk about when we get to week 4. So the greater tuberosity, the lesser tuberosity, and then the intertubercular groove, which is created by those two projections. We also want to think about the deltoid tuberosity. This is found on the lower edge of the humerus, so kind of along the shaft of the humerus. And this will be the attachment for the deltoid muscle, right? So the name can help you remember the anatomy of what structures are going to be connecting to this part of the bone as well. Let's look at the distal end. So the distal end also has some projections and some grooves or fossas. First off, we've got the epicondyles. And we want to kind of look at the terms here. The word condyle means a cartilage-lined surface that articulates with another bone. Okay, we talked about that when we looked at the occipital condyles last week. So a condyle is anytime we have an articulation by a cartilage-lined surface of the bone. And on that basis, we have two condyles, right? We have the medial condyle and the lateral condyle. Therefore, we can talk about the structure that's right above the condyle as being the epicondyle. And again, on that basis, we have a medial epicondyle, epi meaning above, and a lateral epicondyle right above the cartilage surfaces. Now, the cartilage surfaces or the condyles themselves are uniquely named. So the trochlea is the medial condyle or medial cartilage surface, and the capitulum, also called the capitellum, is the lateral condyle or lateral cartilage-lined surface. So don't confuse a condyle with an epicondyle. An epicondyle is just the bony landmark that is found above the condyle. Then we have two fossa right above those cartilage surfaces. We have two grooves that are going to be the articulation of bones, the forearm. So the ulna will articulate into the coronoid fossa, the coronoid process of the ulna, that is, and then the radius will articulate into the radial fossa. Okay, remember the ulna is going to be the medial bone, the radius is going to be the lateral forearm bone. And when the elbow is in flexion, so flexion is closing the angle at a joint, forming a more acute angle as opposed to an obtuse angle, which is extension. So when the joint is flexed, we're going to see the coronoid process sitting into the coronoid fossa and the radial bone sitting into the radial fossa. Okay, now if we look at a posterior view of the distal end, we're going to have another important fossa found here. This is the olecranon fossa. And the olecranon, we'll talk about it. It's a point, it is a landmark found on the ulna. The olecranon will sit into the olecranon fossa only when the joint is in full extension. So when the elbow joint is opened up and the limb is in extension, then the olecranon articulates into the olecranon fossa. And then when the opposite occurs, flexion happens, the anterior processes articulate into the anterior fossa. And then just looking at the shaft as well, the shaft is the same as it is for all long bones. It's really just the middle elongated, cylindrical part of the bone being the shaft. Let's look at the forearm bone. So the ulna and radius. The ulna is going to be your medial forearm bone. So this is going to be important when we think about siding the ulna, whether we're looking at the right or left ulna. I will always show you both the ulna and radius so that you can orient yourself. So in this instance, ulna is on the medial side, radius is on the lateral side. So this has to be the right radius and ulna, okay? And so it's really important to think about how they come together, medial, lateral, and then how they are sort of anchored to the humerus on the right or left so that you can determine if it's right or left. Now, as far as the landmarks or features of the ulna, we have the olecranon being this large sort of beak-like or hook-like projection of the ulnar bone. We've got the trochlear notch. Remember, the trochlear notch is named according to the trochlea of the humerus. I'm going to go back here briefly. So here's the trochlea. And then the notch is going to actually articulate in that space, especially when flexion and extension are occurring. So that is the trochlear notch. And then we have the coronoid process. So likewise, the coronoid process will articulate into the coronoid fossa during flexion. And we have the radial notch being the lateral groove on the ulna, which helps articulate the head of the radius. So the head of the radius is going to sit into the ulna. It's going to be secured by ligaments, and it's going to allow for supination and pronation. Supination being palms up, pronation being palms down, and that is by way of this groove created with the radial notch in the head of the radius. Shifting gears to some of the distal landmarks, we have the styloid process of the ulna. And the styloid process of the ulna is going to help anchor the carpal bone. So actually both the ulna and radius have a styloid process. And so together, those two processes, and styloid means kind of pen-like. In Greek, styloid means pen-like or pen-shaped. And these pointed pen-like projections actually anchor the carpal bones and help to keep them secure in place. Okay, so here we can see the styloid process of the ulna and the styloid process of the radius as well. Both of them sort of securing the carpal bones at the wrist joint. Let's look at the radius. So the lateral forearm bone is the radius. Okay, it's going to be articulated to the ulna at the proximal aspect and the distal aspect. So it's going to form two joints. And we're not actually looking at all the joints here, but it forms a proximal radial ulnar joint and a distal radial ulnar joint. If we think about the head of the radius, it's a little bit more cylindrical than we see for the ulna. And then the neck of the radius is the narrowed portion distal to the head. And then we have the radial tuberosity, which will be the attachment for some of our muscles of the upper limb that we'll talk about, okay, such as the biceps brachii. So the radial tuberosity is going to be this roughened projection on the radius that helps to anchor some of our muscles. Okay, let's look at the rest of the limb. So this is forming the hand, and we have several bones coming together to form the wrist, the hand, and the fingers or digits. So the carpal bones, there are 8 of them. They are each uniquely named. You don't need to memorize these, in terms of which one is where, but you may get a, possible bonus question if you do know that the scaphoid is the first on the radial side, right? First row, radial end. You will get bonus points for knowing where these are, but you should know their names, right? You should know the names, and then you should know the total number 8 of these bones. So we have the scaphoid being the first on the proximal row, so at the radial end. Then we have the lunate being sort of second in that row. And then we have triquetrum being third, more towards the medial edge of the hand. And then we have pisiform. So these are the first 4 bones in the proximal row: scaphoid, lunate, triquetrum, pisiform. If we go to the distal row, again, naming these from the radial end to the ulnar end, we've got the first up being the trapezoid. So the trapezoid is this large bone sort of beneath the second digit. The capitate. Capitate is the largest bone. I think I missed the trapezium, excuse me. The trapezium, then the trapezoid, then the capitate, and then the hamate, okay? So trapezium being the first, right under the metacarpal, so the first thumb digit, then trapezoid, capitate, and hamate. Now, an interesting mnemonic that may help you to remember this is she looks too pretty, try to catch her, okay? And there are several different versions of that may help you, but she looks too pretty, try to catch her, right? And that is keeping them in the correct order as well. Let's look at the rest of the hand bones starting from the metacarpals. Now, these are not uniquely named, and we have 4 to 5 of each, starting with the metacarpals. So these are long bones that form the flat of the hand or the palm surface of the hand. They are named 1 through 5. So metacarpal number 1, metacarpal number 2, metacarpal 3, 4, etc. Then we have the proximal phalange. So the metacarpals articulate to the proximal phalange, and we are also having these named 1 through 5 according to their location from the first digit to the 5th digit. They articulate only in the 4 digits do they articulate to the intermediate phalange. So we don't have an intermediate phalange for the first digit. We only have a proximal and a distal. And then finally, the distal phalanges 1 through 5 are going to be the smallest and most distal phalange that form the very tips of the digits.